So this week we're going to be covering Chapter 7, which is covering the depressive and bipolar disorders. Have the learning objectives here. They're also in our classroom. I want to make sure you check those out. Some key vocabulary, and there's actually quite a few vocabulary words that are covered in the text, but I do want to go over depression, mania, and bipolar disorder. So I'm going to take just a couple minutes to go over those in this recording. So let's start with depression and what would constitute a major depressive episode. So what I have here is the diagnostic criteria for a depressive episode, and this is taken directly from the DSM-5. So in the DSM, it gives us the ingredients or the criteria for what is required to give somebody a diagnosis for major depression. And what they say is you need to have 5 or more of the following symptoms. And these symptoms have to be present during the same 2-week period, and they have to represent a change from previous functioning. And that is important, and we'll talk later about some of the personality disorders, but we're looking for 2 weeks, at least, a minimum of 2 weeks, and a change in the person's behavior. And you need to have at least 5 of these different things. And in addition to that, we're looking for the person to have at least to have a depressed mood and a loss of interest or pleasure. So these are the things that we're looking for. 1, the depressed mood most of the day, nearly every day. And that can be the person is reporting that. So remember the very first lecture that we ever had, we talked about how a person can come in and they can report that they are feeling sad or that they are subjectively hurting. So that would be one of the criteria. And it does note that children and adolescents can report that differently. The second would be a markedly diminished interest in pleasure at all. So in other words, the things that you used to enjoy doing, you don't enjoy doing as much anymore. Weight gain or loss when you're not trying to gain or lose weight. Insomnia or hypersomnia. So it can go either way. For some people, they can't sleep. For other people, they have a really hard time getting out of bed. Number 5, psychomotor agitation or retardation nearly every day. In other words, a person can be really slow moving or they can be agitated. Fatigue or loss of energy nearly every day. And again, remember, this is a change in behavior. 7, feelings of worthlessness or excessive or inappropriate guilt, which may be delusional nearly every day. So we're looking for somebody who perhaps they're feeling guilty or they're feeling especially bad about things that it's not their fault, and you as their friend or perhaps as their therapist, you can clearly see that it's not their fault, but they are expressing inappropriate guilt over something. Diminished ability to think or concentrate, indecisiveness nearly every day. Recurrent thoughts of death, and that's not just a fear of dying, but recurrent suicidal ideation without a specific plan or a suicidal attempt or a specific plan for committing suicide. So we're looking for 5 of those criteria. And then some of the things that I've highlighted here. B, the symptoms caused and highlighted here, clinically significant distress or impairment. And that goes back to our very first lecture. Remember, we talked about how there has to be impairment. So there has to be impairment in social, occupational, or other important areas of functioning. So it's beyond just feeling sad. It's beyond sleeping in and having a hard time getting out of bed over the weekends. So you're seeing something beyond it's causing impairment. The person's now not able to get to work. They're not able to do their social obligations. It's impairing their roles in life. And then C, and this is something that we talked about earlier also, that it's not the cause of substance abuse. So remember, we need to first rule out that these symptoms are not because of drugs or alcohol, and they're not because of any sort of medical condition. Though medical conditions and drugs and alcohol always preempt psychological disorders. So before we would go and diagnose a psychological disorder, we always need to make sure first, well, is the person using drugs or alcohol? Does the person have some sort of medical condition? Now, there are times that we do diagnose both, and we will talk about that a little bit later, but always need to be careful because we don't want to diagnose somebody. Let's say we were to diagnose somebody and they were using drugs and alcohol. Well, what if they weren't using drugs and alcohol? Would we have the same symptoms? So we need to be very, very careful and make sure that when we're diagnosing for for the right reasons. So this would be a major depressive episode. And do you see how it is different than what we all experience? Because everyone in this class has experienced being sad, has had periods of time where you have maybe gone through a loss or a breakup, or you've had a hard time getting out of bed. So this is different to meet the criteria for 2 weeks or more that you were not able to meet your day-to-day obligations. You need to have 5 or more of these symptoms. The other thing that I want to mention about depression is, and this is in the DSM, it cannot be a response to a significant loss. So let's say that you had a parent or a spouse or a best friend or a cat or dog. I mean, so if let's say it's bereavement, somebody close to you passed away, we would expect, in our culture, we would expect you to be sad, and that is part of the normal bereavement process. So if you are going through some really difficult times, we would not diagnose you with clinical depression. There's another diagnosis. So it's written into the DSM that if you are having these symptoms, but it is because you've had a significant loss, let's say there was a natural disaster, let's say you just found out that you have a serious medical condition, any of these types of things, we would not diagnose major depression initially. Now, down the road, let's say that you lost a parent or you lost a loved one. Down the road, it would be possible to diagnose somebody with major depression if a period of time passed and the clinician felt that this is beyond the normal bereavement process. So this decision requires clinical judgment, and you have to take a look at the individual's history and cultural norms and make some sort of clinical decision. But again, I want to stress that we do not diagnose major depression because somebody is feeling sad. And even if there is impairment, if there's impairment, but it's because of something that's happened in your life, and we would expect that anyone would be having those symptoms, we would not make that diagnosis. Okay, so what I have here are the diagnostic criteria for manic episode. And the reason why this is important is a manic episode is what we look for to diagnose bipolar disorder. So as soon as you have a manic episode, the diagnosis then becomes bipolar disorder. And there's 2 types of bipolar disorder. There's bipolar disorder 1 and bipolar disorder 2. The basic difference between those 2 is severity, and your book explains some of that. But the important thing that I want you to leave the class understanding is how important a manic episode is. So let's first go over what a manic episode is, and then I'll explain why it's so important to understand what it is. A manic episode, and I'm looking at A right now, is a period of abnormally and persistently elevated, expansive, irritable mood and abnormally persistent increased activity or energy lasting at least 1 week and present most of the day, nearly every day. So for 1 week, you have somebody who is elevated, expansive, they have incredible energy, and they can be irritable. They can seem like they just are go, 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 go. For major depression, remember, we were looking for 2 weeks. For manic episode, we are just looking for 1 week. During this period of time, there's increased energy, and you need to have 3 or more of the following symptoms. You need to have inflated self-esteem, decreased need for sleep. The person could be more talkative than usual, or what we call pressured speech. They have flight of ideas. They're very distractible. They have increased goal-directed activities. They have excessive involvement in activities that have a high potential for pain consequences. Give you some examples of those. I've worked with some people who normally were not at all promiscuous, and during a manic episode, they were promiscuous. They perhaps normally were very conscientious with spending money, but during a manic episode, they would spend an exorbitant amount of money. After the manic episode, they'd be devastated and look back and shocked at the amount of money they spent and about some of the behaviors that they had exhibited during the manic episode. The flight of ideas, just rapid things. Thinking that they could rule the world and conquer anything. And I've worked with people who've gone in and quit their job and decided they were going to, this new invention that they came up with was going to make them millions of dollars. And, off they went, and it wasn't even a concrete idea of something, but they were so caught up in the ideas of how they were going to, just everything was going to come together and work together, and their thoughts, in their world, everything was going to be okay. So we have at least 3 of those symptoms. It causes impairment, just like any of the other disorders. Remember, we talked from the very first lecture, it needs to cause impairment. It is not the result of a substance, so it's not drug abuse, it's not medication, it's not due to any sort of medical condition, it's not a tumor. There's all that's been ruled out. So we have a manic episode. As soon as you have a manic episode, the diagnosis becomes bipolar disorder. It's very important because the treatment is different for bipolar disorder versus depression. The medications are typically different. And we want to be careful with that because we do not want to inadvertently give somebody medication that might bring on another manic episode, because manic episodes can be very disruptive. And even though the person may seem like they have a high self-esteem and they may seem like they're on top of the world, they are also at risk for suicidality. They are also at risk for doing things that really can cause a lot of pain and turmoil in their life, in the lives of their loved ones. So if you have somebody who has depression, I'm talking episodes, and then they have a manic episode, from then on, their diagnosis would be bipolar disorder. So whenever they go in and they're talking to a new psychiatrist or a clinical psychologist who's diagnosing them, we're going to ask them if they've ever had a period of time where there was a manic episode, and if they give us reason to believe that has happened. Even if they come in right now as depressed, the diagnosis is bipolar disorder. And again, the reason for that is we just need to be so careful with the treatment, and making sure that it's that we're carefully treated. So there is more in your book about that I just wanted to be sure to explain, because I think sometimes students get a little bit confused and they think that it's manic depressive, and however you're feeling at the time is what you are, and that's not the case. So these are the criteria for manic episode. Manic episode, diagnosis is bipolar disorder. Okay, before I go into what is due this week, I did want to mention that there are some really great things in your textbook. And I know you guys are going through and reading your textbook, but I really hope that you do for this chapter, because depression is something that if you personally have not experienced, I can promise you that you will know somebody in your life who will experience. It is so common. And there are some really great things and information in this chapter. Especially, I'm taking a look at the benefits of exercise, and there's some studies on therapy versus taking medication versus and exercise, and just some great information. So I really encourage you to thoroughly read chapter 7. So great stuff in there. Okay, so what are we doing this week? So in our learning module, you have the chapter 7 learning objectives. Then I have the 2 videos that you will be quizzed on. They are already posted. There is also the chapter quiz. I will have, if you are looking at this early in the week, I do not have the quizzes posted just yet, but I will have those up shortly. So we will have, starting on Monday at noon, the crash course or the video lecture quizzes will be posted, and then the chapter 7 chapter quiz is already up and ready to go. So if you have any questions, let me know. And I certainly hope you enjoy this chapter. I think there is a lot of good information in your textbook. Have a great rest of your week, and take care.